Have you lost a tooth and in correlation with that, lost some bone and you're wondering, can I get a dental implant? I'm Dr. Miro and I'm a dentist here at Dental Implant and Aesthetic Specialists. And today we're going to talk about the things we can do to assure you can get an implant even with that bone loss. Whether you've been diagnosed with bone loss or you know that you have bone loss because you had an infection when you lost your tooth, or you've been missing a tooth for a really long time so that bone just kind of started to fade away. Really, the main diagnosis tool these days is a CBCT. A CBCT is this 3D image that before you get an implant, you take. This really gives you a three-dimensional view of what the area where we're placing the implant is going to be. Sometimes you might need a little bit of more height in your bone. Sometimes you might need a little bit of more width. Whatever it is, this diagnostic tool really allows us to see where you need the bone and how we can add it. Let's talk about the different ways that we can add bone, build bone, depending on exactly what you need. A lot of times, if you're just losing the tooth for the first time, what we do is a bone graft. A bone graft is usually filling the space where the tooth is being taken out with bone. The bone that's used to fill the space where you've lost this tooth can be found in this video above. Now, to continue talking about the different options. One thing that happens when you lose teeth is you lose your ridge. Ridge is basically the width of where it used to be. So what we need to do is expand this. There's lots of different tools that we can use to make sure that we widen the area where you've lost the bone. This helps because then we can place a bigger implant with more stability in the area. One of the main concerns is when you lose bone around your sinus. Your sinus are these little holes up here where you breathe in and out of. A lot of times when you lose teeth on the top towards the back, your sinus will start to fill into that space. What we do in this case is we actually add bone around the sinuses. This is called a sinus lift. If you're the patient that has tried a lot of things, you've had a sinus lift, you've had a bone graft, you've had your ridge expanded, and you still can't seem to get enough bone, there's also options for you. Here at Dental Implant Aesthetic Specialists, we try to give patients single tooth replacement. That means sometimes if we need to use an angled implant to make sure we can get enough bone, or a shorter implant, we do have those options available to our patients. If you've lost bone or you think you've lost bone and you still want a dental implant, we're here to help you. I'm Dr. Miro and I'm a dentist here at Dental Implant and Aesthetic Specialists, and I'm here to help you. Watch your mouth.